Hello everyone, this is Amaar Zaidi, and today I'm going to be doing a video on arrhythmias, and more specifically, I'm going to be covering AV blocks. Now, what's an arrhythmia? Arrhythmias are basically described as abnormal rhythms, which are sometimes due to some underlying cause or could be normal. अक्सर they can be benign या asymptomatic और कोई treatment की ज़रूरत नहीं होती. But anyway, for example, in cases where it's like normal, it's like when endurance athletes tend to have sinus bradycardia. It's because their heart is so muscular because they've done so much endurance training कि उनकी normal resting beat is less than 60. The heart doesn't need to beat as fast when they're at rest. Anyway, with that out of the way, let's talk about first degree AV block. Let me check my marker out. Yeah. So first degree AV block. Now, the thing about first degree AV block is that the AV node block occurs when the conduction to the AV node is slowed, thereby delays the time it takes for action potentials to travel from the SA node to the AV node and then to the ventricles. Now, how do you identify first degree AV blocks? Now, simply put, there's a thing called the PR interval, and this is the PR interval. I'm sure you already know by now what PQRS waves are. This is ये P wave है, this is the QRS complex, this is the T wave. Now, a normal PR interval, it lasts between 120 to 200 ms, which on an EKG it's about 3 to 5 boxes. Now, during certain pathologies or abnormalities, ये 3 to 5 से ज़्यादा होता है. It's more. जो भी अगर X is like number of boxes and it's more than this, you have PR interval prolongation. Like for example in first degree AV block, PR interval as you can see यहाँ से start होता है, यहाँ से लेके यहाँ तक. बहुत thick हो गया marker, but anyway, like about this much. Now, as you can see, this is exceeding 3 to 5 small boxes. I meant to say small boxes. And it's like going beyond like 6, 7, 8 boxes पे जा रहा है. And then you look at this, कि एक और PR interval देख लेते हैं. यहाँ से लेके यहाँ तक. You see it's still more than 3 to 5 boxes. यहाँ से लेके यहाँ तक, still more than 3 to 5 boxes. Yep. Because the PR interval is prolonged, we can note this as first degree AV block. Second example is second degree AV block. Morbid's type 1. इसको Wenke block भी कहते हैं, whatever you want to say. So the thing about this one is that progressive lengthening होती है of the PR interval. Like the PR interval, this is the PR interval, remember? ये यहाँ से लेके यहाँ तक. I'll just do it here, yeah. Now यहाँ this identify this P wave. So there's progressive lengthening. Like यहाँ पे ये size है, फिर यहाँ पे इसका ये size आ गया, फिर यहाँ पे it's increasing. There's progressive lengthening up until a point कि यहाँ पे P wave आया and there's no QRS complex that follows it. This is known as a drop beat. ये beat drop हो गया. Progressive lengthening के बाद drop हो जाती है wave. And usually it's asymptomatic and इसमें basically there's failure of conduction through the AV node such that sometimes the P waves may not be followed, or increasing delay of AV nodal conduction की वजह से P wave fail हो जाती है conduct होने में. So yeah. And also another thing to note is the irregular RR interval. R wave yeah, R wave yeah. This is an RR interval. Look at this. Like it's uneven. यहाँ से तकरीबन you can say it looks a bit same. But then the drop beat okay, now this is your RR interval. So yeah, there's a variable RR interval. Therefore, you can call this regularly irregular. I mean, it takes too long to write. I'm on short on time. This regularly irregular. Second degree AV block पे आते हैं morbids type 2. Now in this one, basically the drop beats इसमें भी drop beats हैं morbids type 2 में. Drop beats हैं, but it's not preceded by a change in length of the PR interval as in type 1. इसमें type 1 में basically PR interval gets lengthened progressively. इसमें the PR interval remains normal. Pretty much constant रहता है यहाँ से लेके यहाँ तक, यहाँ से लेके यहाँ तक. It seems pretty much the same up until there's a drop beat. Drop beat में you can always assume there's second degree hard AV block. And because there's no like progressive lengthening of the PR interval, but there is a drop beat, you can call this morbids type 2.